It's been 17 months since Ghana confirmed her first 2 positive cases of COVID-19. Now infections continue to rise as skepticism and myths about vaccinations dominate a lot of public discourse. With a cumulative number of 120,452 cases confirmed in a period beginning March 12, 2020, nearly 2 people succumb to the virus every day, bringing total deaths to 1,052 as of August 30, 2021. Most of these people are buried by the COVID-19 burial team under strict supervision by the Ghana Health Service. It is Thursday, August 19, 2021. It is a busy day for the environmental health officers of the Accra Metropolitan Assembly. The team is burying 5 more bodies at the Awudome Cemetery.
I tell every Ghanaian that the COVID is real. So we have to rule our mind out that the COVID is not there. I always say, it doesn't pay any doctor. Doctors don't get a reward for labeling any family member as a COVID body. Okay, and we are the last end of solving the problem. If the medical report don't indicate that it's COVID, we have no hand in the body. When we go to the mortuary, we see a lot of bodies there. They are not COVID. The family members are handling it. That's once the doctors who handle the body confirm that it's COVID before we come in. So that one they should believe and protect themselves. Today, for instance, we have taken 5 from Rich Hospital. We've buried them. 1 is there. We are going to cremate that person. 2 is coming from Ghana East, making harmony 8. So that is only for today.
Before this trip, bodies in a double digits had been buried by the team, and this trend has dragged since June 2021. About 4 months before that, what pertained was the exact opposite. Active cases were as low as 1,414, shared among less than 10 of Ghana's 16 regions. Health facilities at the time had just begun heaving a sigh of relief as the country was just coming out of a devastating second wave of the virus, largely driven by the B117 UK strain. Fortunately, during this period, government had taken stock of several consignments of the Indian-made AstraZeneca vaccines shipped off to Ghana under the various vaccine acquisition platforms, mainly the COVAX facility. And inoculation had started with focus on at-risk segments of the population within the country's hotspots.
Nearly 1 million people have now received the first dose of the vaccine. International vaccine politics and the unpredictability of the supply chain, as well as the third wave of infections in some countries in Europe and Asia, have meant that we have not been able to secure as many vaccines and vaccinated as many Ghanaians as we would have wanted.
We were indeed not out of the woods yet. The progress of the inoculation exercise in Ghana, like in most of the other countries which depended on the COVAX platform for the jabs, will be significantly delayed by global vaccine shortages, occasioned by new waves of the virus in vaccine-producing countries, especially India.
The Delta variant has come into the country and basically knocked out all the other variants that we had in the country. And that again taught us that these variants actually are more, this Delta variant is much more competitive and much more efficient than the Alpha, which at the time was the strong one. So it just tells us that there's still a lot out there that we don't know about this virus, and there's still a lot to come from this virus because we don't know how the next variant will look like, and if it will be more vicious than the Delta.
In Ghana, government led by the Ministry of Health attempted, unsuccessfully though, to explore other avenues of vaccine acquisition, particularly government's dealings with one Sheikh Al Maktoum in getting the Russian-made Sputnik V vaccines hit a major snag as concerns were raised over the procurement processes and possible loss of state funds. This followed the failure of the Sheikh to deliver on the terms of the contract. A parliamentary probe later established that the deal was not in the interest of the state. Minister of Health Kwekwajiman Menu admitted he could have done better.
Madam Chair, I've explained that those were not normal times, and I was seriously in the situation that couldn't make me think properly the way you think that now. I will actually address myself to the situation.
So in the absence of the vaccines, experts maintained the only remaining buffer against the virus was the wearing of the face masks and strict adherence to other safety protocols. But were their calls heeded?
Confused emergency be bad ya meet me the shaman.
This sustained disregard for the mask wearing and physical distancing rules continued for the next couple of weeks. Sometimes the worst culprits being senior members of government.
Who are the key individuals who were present there over the weekend at this particular funeral? The big roll call. We have the president himself in attendance. We have the vice president in attendance. We have the Chief Justice also in attendance. They were all present at this funeral where we saw these pictures.
For example, experts went to town over protocol breaches at the funeral of the late former General Secretary of the New Patriotic Party, Kwejo Owusu-Afriyie.
And just looking at the footage, I mean, there's no doubt in my mind that there is definitely cause for concern. From a public health perspective, definitely what you would call in global health language, a potential, let me be really accurate here, a potential super spreader event.
544 doctors were infected over a period of 12 months. 1.7% of these figures had critical disease. And as I mentioned, we lost 7. And these 7 that we lost were doctors of high caliber. Most of them specialists, consultants. So watching it and knowing that my colleagues paid the ultimate price and seeing that level of recklessness, I was feeling very sad and disappointed.
If you have a government that came up with a, Imposition of Restrictions Act, blatantly flouting their own rules, how is that going to affect every other Ghanaian who really does not believe it or who already feels disposed to treat the law with contempt? It's the backlash, that kind of backlash against law and order, and the bad example, the extremely bad example government was setting.
Soon, the worst happened. The number of new cases began to rise sharply, with more critical and severe cases being reported at the hospitals. Most of these cases could be traced to large events. I have come to the female COVID-19 ICU of the Greater Accra Regional COVID-19 Treatment Center to observe for myself. The lives of patients here are hanging in the balance as they continue to battle to stay alive from one oxygen cylinder to the other. For those who are lucky to have been stabilized, they dread the experience and wished they did more to protect themselves. And just like them, most of the cases being reported at the hospital were from unvaccinated people. Head of the COVID-19 response team at the hospital, Dr. Emmanuel Ahiable, explains.
It's very important to note that the cases we are having on our treatment center, most of them have not been vaccinated. Most of I can count those who are vaccinated, maybe 1 or 2. But they get better and they go away. They are discharged, But those who are dead now, most of them have not been vaccinated. So vaccination history is now something we are taking. Try to see if those who are having a severe or critical condition are vaccinated or not. So this variant is so virulent, like you said, virulent and very highly infectious. So if you have not been vaccinated before and you are having underlying conditions, when you get infected, you may have the severe or the critical form.
He speaks of how this trend of increasing critical and severe cases began to take a toll on the operations of the facility.
The number of cases have exponentially gone up the third wave. Because in the second wave, we're not having many patients, even at the emergency department, who are tested positive. But now, as I speak now, the COVID ICU is full. The isolation center, the holding center, which is supposed to be for suspected cases, is also filled with positive COVID-19 positive patients. And there's the spillover at the emergency department, also have COVID, about 12 of them. So this third wave, which hospital is overwhelmed, all our spaces are filled.
Indeed, the story was similar in all other COVID-19 treatment centers across the country. Unequivocally, the third wave of the virus was upon us.
It is extremely troubling to note that the high compliance rate with mask wearing has fallen alarmingly.
At this time, government heightened its efforts at procuring more vaccines to get its inoculation drive back on track. Ghana took delivery of some 350,000 doses of the AstraZeneca vaccines originally meant for the Democratic Republic of Congo. They were diverted to Ghana owing to the country's demonstrated capacity in administering the vaccines.
FDA is a master at this, and we support them because we also have a vested interest in safety. Remember, we are dealing with, our whole program is immunization. One case of a wrongly managed adverse event can destroy the whole program. So the slightest issue of safety, we detect it. And if we have to take action, it is taken. And that's why we work so closely with FDA in that. We have structures from national to the very community, the last community.
Globally, the latest vaccination rate on average is 41 million doses per day. Countries and regions with the highest incomes are getting vaccinated more than 20 times faster than those with the lowest. At this pace, it will take another 5 months to cover 75% of the world's population. Israel was first to show that vaccines were bending the curve of COVID infections. The country led the world in early vaccinations, and by February, more than 84% of people aged 70 and older had received 2 doses. As of August 30, more than 5.26 billion doses had been administered across 183 countries, according to data collected by Bloomberg. Meanwhile, in Ghana, infections continue to rise as skepticism and myths about vaccinations dominate a lot of public discourse.
No,
the best solution any akufado yen pa no mo yeke mo fe ma ka awun sho. The best solution ila fe ila ni ba mo. Ya sho na. Ka lo mo bo no te sho na. E ba dan. Sure.
Shake vaccine ba na agbo.
Vaccine make flash.
Vaccine wo insure je vaccine ha.
Insure vaccine make ye na me yo.
Amegbu so shi wo vaccine no ji insure.
I have come to the University of Ghana, where researchers have led the country's efforts towards learning about the virus through sequencing and other studies. Quite ironically, some of the students here still have some skepticism about the virus. I meet Joylene, Brooks and Ibo. They all have different reasons for not taking the vaccine yet.
When we recorded our first case in Ghana and other cases started rising, I was scared at that point because I wasn't going out at all. But after the month passed and some of my friends contracted the virus, they recovered quite fast. And they told me that it was a bit scary, but it wasn't that scary. So I realized that even if I contract the virus, it's not as deadly as it seems.
I've not taken the vaccine yet, and that is simply because I haven't had the opportunity to. The first rollout that was for a specific group of people. Now we understand there's another one, the Johnson & Johnson vaccines, but currently where I live, the district that I live in, it's not part of the district where you can get vaccinated for the Johnson & Johnson vaccine. And so I'm waiting till it gets to my turn, and then hopefully I'll take it.
I've personally not taken the vaccine because of certain unanswered questions surrounding the efficacy of the vaccine, especially when people have taken first shot, second shot, third shot of the vaccine are still contracting the virus and are dying. We understand that we keep having mutations and new strains of the virus. And so that is what is amounting to the difficulties surrounding fighting the COVID-19. But if people are taking the vaccine and are still dying, it begs us to ask the question, what are the odds?
Indeed, questions on the efficacy of the vaccine were expected, at least from the admonishing of the Director General of the World Health Organization, Dr. Tedros Ghebreyesus.
We have no guarantee that any single vaccine now in development will work. The more candidates we test, the higher the chance we will have a safe and efficacious vaccine.
Meanwhile, outside the university, there are many more vaccine skeptics spreading conspiracy theories about the vaccine and its effect on recipients. While some say the vaccine has a potential of disrupting the menstrual cycle of women, others say it has magnetic qualities.
Ghana for me and you. I don't know what can no cray. Here, I had a walk on the phone and I hang on. And then I would say with him. Women be so, and then the say with him. Yeah, I who said begin and be questions, and when they say I got Johanna faith near the way. Eh, Mummy, if you look at crow, you're 3 or 4 yen. I didn't attack the yo.
I'm a Ghana police me. Who want to marry me? Crest no. Baby, I'm what job nini. Any Masa why?
But is this true?
The idea, I'm not going to be any phone it off from Safran to Toffom. To be a man, one in the end, to be any free.
I'm shaking the asset, you, if you told from. We
got individuals who have taken the vaccine at a vaccination point and then got them to attach their phone to the upper arm. Some of them, the phone stuck momentarily and then fell off. Others, it didn't. We also made these people wash the sites of vaccination with water to remove any creams or oils that may be on the skin, and also cleaned the surface of the phone with alcohol tissue to remove any oil on it. And when they attached it, it didn't. So we concluded that the sebum, or that oil on the skin, has a sticky property, that is wax and oil mixed. So that if you have sebum on your skin and you attach any material, any light material like even plastic, would attach, a key will attach.
Already, there has been a vicious tussle within the Christian faith, with the utility and relevance on one side and the prophetic essence of it on the other side. Generally, health authorities are focused on convincing people to receive the shots rather than compelling them. Several strategies have been employed to see this through. Joyce Ifutu is Director of Communications at the NCCE.
That we are preaching the gospel of civic education. But 2,000 years ago, when the Bible was written, Jesus came and all that. Thou shalt not steal, but people continue to steal. So we still have people who will not believe that COVID exists, and then they will be saying all manner of things. So what we are doing is we will continue to engage, because in a democracy, people have their rights. So you cannot impose things on them. So we'll continue to engage to tell them the benefit of getting vaccinated, so that they can all help in the fight against the pandemic. So that is what we'll be doing.
Vaccine hesitancy is not new. Reference is made to the infamous Qatar incident in America, which involved polio vaccines in 1955.
These are not live. You see, the polio incident is different. I'm sure you are referring to the Qatar incidents of the 1950s or so, or I think earlier than that.
55, a year of anxiety and triumphs. A major medical hurdle was crossed with the discovery by Dr. Jonas Salk of the anti-polio vaccine.
Even though approval for Jonas Salk's polio vaccine was not in a record 8 months like COVID-19 vaccines, licenses were hurriedly granted to several drug companies, including Qatar Laboratories, to make the vaccine. The very day news broke that clinical trials, after close to 4 years of research, had been successful. About 165,000 doses of Qatar's shots went out. Not only did some people injected with a tainted vaccine get sick, but some who got the vaccine went on to infect family members and neighbors. The US government ordered the Qatar vaccine to be withdrawn on April 27 same year, but damage had already been done. The vaccine had paralyzed or killed 25 children. So yes, People are probably right to be apprehensive given that these vaccines were produced hurriedly. But what vaccines do we have and what does the science say? Professor Gordon Awandare is Director of West African Center for Cell Biology of Infectious Pathogens at the University of Ghana.
What we need people to understand is that these vaccines are sort of a temporary solution. We would get better vaccines. As the disease stays with us, more research will produce better vaccines that are much more effective at even stopping the infection.
So why doesn't it provide full protection against the virus?
The Delta variant has come into the country and basically knocked out all the other variants that we had in the country. And that again taught us that these variants actually are more, this Delta variant is much more competitive and much more efficient than the Alpha, which at the time was the strong one. So it just tells us that there's still a lot out there that we don't know about this virus, and there's still a lot to come from this virus because we don't know how the next variant will look like, and if it will be more vicious than the Delta. And
already, there are suspicions that sponsors of the COVID-19 vaccine development want to use the jabs to centralize global order by issuing COVID passports. Much as this assumption is false, the COVID-19 passport may become mandatory, and this is why.
If you are not vaccinated, it's like you have the yellow card. You're going to go to a country like Singapore, South Africa. The first thing they'll tell you is not giving the visa. They say a yellow card. So no yellow card, don't try. Do you understand? And I think to make a lot of sense that, I mean, I need to be fully protected. So bring the evidence that you are immunized, you are immune.
The Ghana Health Service issues about 2,000 yellow cards every week. That's for vaccination against yellow fever. These are mostly to people traveling out of the country. It cannot be overemphasized that the success of the inoculation is hinged on herd immunity.
It is important for us that not until we get a critical mass of people who are vaccinated, for which reason we get what we call population immunity.
For Professor Awandare, this herd immunity in itself may not be guaranteed. He predicts that the consistent mutation of the virus and the introduction of new variants may necessitate periodic vaccination, unlike the anticipated one-off inoculation.
No, because this virus is changing and quite rapidly, it means that the way we deal with it is going to be more similar to how we deal with influenza or flu, which is that every year or every few years, you have to revise the vaccine. You have to remake the vaccine to account for the variation in the virus that's in circulation. Every year, a new virus strain comes around, or every 2 years. Then you have to sort of edit your vaccine to match the new one. So we can envisage that for COVID-19, we're going to be doing the same thing, that every year or maybe even every 6 months, you may need to go and get a booster, you know.
Perhaps this explains why government is bent on boosting the country's preparedness for future pandemics.
The committee I established under the leadership of the world-renowned Ghanaian scientist, Professor Kwabena Frimpong Boateng, to investigate Ghana's potential as a vaccine manufacturing hub to meet national and regional needs, has presented its preliminary report, which amongst others recommends the establishment of a National Vaccine Institute.
This has received a massive vote of confidence from the experts, as at least 4 local vaccine manufacturing companies express readiness to produce vaccines in Ghana. Professor William Ampofo is a member of the committee.
I mean, one of the private sector companies, DEC Vaccines, has already gone ahead and secured a government guarantee in terms of its stated aim to establish vaccine manufacturing, and this has enabled them to go ahead and pay a deposit for equipment that they need and pay their business plan to set up vaccine manufacturing in Ghana. And this government guarantee is very important for private sector, investment.
Vaccine hesitancy and the global vaccine shortage driven by vaccine nationalism stand in the way of achieving herd immunity and in fact may impact Ghana's ability to attain vaccine self-sufficiency. For Professor Gordon Awandare, having access to the jabs is a privilege which must be embraced by all.
A lot of people are getting infected, and we don't know what the long-term effects of that will be, because we have seen that this particular disease, people respond differently in different parts of the world. That's why in Africa we've been lucky that it hasn't been as devastating here. But it could be that our effects will be more of the long-term effects. So we don't know what will happen 5 years from now or 2 years from now.
With each passing minute that you refuse to receive the jabs, you expose yourself to becoming one of the names behind the scary statistics. It may not end with you, but it definitely starts with you. Get the jab and help the country's mobilization against a common enemy. Manuel Cranting, JoyNews, Accra.